The presentation, What Assistance is Available for People with Disabilities, is for professionals who work with people with disabilities. It is presented by Granite State Independent Living's Financial Planning and Benefit Services. What are some possible assistance programs for people with disabilities? Social Security, which can provide financial assistance, and Medicaid, which can provide medical coverage. What is Social Security? Social Security is a federal program that can provide financial assistance to people who have a disability under two different programs: Supplemental Security Income, SSI, and Social Security Disability Insurance, SSDI. How does Social Security help a person with a disability? Social Security provides financial assistance to people that meet the eligibility requirements. What is the difference between Supplemental Security Income, SSI, and Social Security Disability Insurance, SSDI? SSDI, you have to be between the ages of 18 and full retirement age. You have to have a work history. If a person does not have enough work history themselves, they can qualify under another's record if they have a parent who receives retirement benefits, a parent who receives disability benefits, or have a parent that is deceased and had a work history. This benefit is known as the childhood disability benefit. If a person is a widow or a widower, they could possibly receive a disabled widow or widower benefit. If they have SSDI, they receive Medicare coverage. There is no unearned income limit or resource limit. And if a parent receives SSDI and have minor children under the age of 18, they can receive auxiliary benefits for them. SSI has no age requirement. A child or adult with a disability can receive SSI, as well as a senior who is over the age of 65. It is a needs-based program, meaning there is an unearned income limit. In 2014, that is $741 per month. There is also limited resources. It's $2,000 for an individual and $3,000 for a couple. Okay. Most people who are on SSI have a limited to no work history. You can qualify for Medicaid coverage. In New Hampshire, it is not automatic. You do have to apply for Medicaid separately. The maximum SSI cash benefit for 2014 is $721 per month for an individual and $1,082 per month for a couple. There is presentations on SSI and SSDI that are separate and provide more information on the programs. If you are working with a person and they are on a benefit but aren't sure what one, here are some questions that you can ask to try to figure out. Okay. Do they receive one check or two checks? If they receive two checks, they receive both SSDI and SSI. How much do they receive? If they receive $721 at the first of the month, then they probably have SSI. If they are working and the amount changes, then they have SSI. If they receive more than $721 and the amount does not change if they're working month to month, then they probably have SSDI. If you really aren't sure, you can contact Social Security and they can let you know what program they fall under. Another question you can ask is, do they have Medicare? If they have Medicare, then they have SSDI. What is Medicaid? Medicaid is medical coverage that is provided through the state of New Hampshire that will cover most medical costs. Children, people with disabilities, and low-income parents with minor children can apply for Medicaid. For more information on Medicaid programs, please see the separate Medicaid presentation. How can Medicaid help a person with a disability? If a person with a disability does not have medical coverage, Medicaid can provide that for them. and they can get the care they need. Want more information? Here's how you can get more information. You can view the rest of the videos to learn more. You can contact Granite State Independent Living for assistance. The Financial Planning and Benefit Services phone number is 877-809-7028. The website is www.gsil.org, or the Financial Planning and Benefit Services email is benefits@gsil.org. You can visit New Hampshire's Work Incentive Resource Center for more resources at www.nhwirc.org. You can contact Social Security Administration and New Hampshire's Department of Health and Human Services for more details. Social Security's website is www.ssa.gov. The Department of Health and Human Services website is www.dhhs.state.nh.us. If you are connected with an area agency, mental health center, or vocational rehabilitation, you can contact them for more information and assistance.